New Delhi hospital sees influx of patients as country battles COVID-19 crisis. Journalists expressed concern over limitations on access to information. COVID-19 worsens fight against tuberculosis in Nigeria. These and more coming on The World Today. Hello, this is The World Today newscast with me, Mariama Cham, and thanks for joining us. A hospital in New Delhi has received a steady influx of patients on Monday as the country keeps breaking records in new COVID-19 infections. India has been struggling to provide medical assistance to patients and lack of ventilators and hospital beds. The tally of coronavirus infections in the Asian country rose on Monday to just short of 20 million, propelled by 12th straight day of more than 300,000 new cases. Fatmata Kasim has the rest of that.
Several ambulances continue to arrive and leave the New Delhi hospital that is receiving an influx of COVID-19 patients on Monday as the country keeps breaking record in new COVID-19 infections. The country announced on Saturday it intends to vaccinate all adults against COVID-19. India has been struggling to provide medical assistance to patients amid lack of ventilation and hospital beds. Total infections since the start of the pandemic have reached 19.93 million, swelled by 368,147 new cases over the past 24 hours, while the death toll rose by 3,417 to 218,959, Health Ministry data show. Scientists predict the pandemic could peak in next couple of days. A large screen placed outside the hospital counted that the total number of the hospital beds and patients, both of which amounted to 1,500, with no available bed left. A patient was seen lying inside the back of an ambulance parked outside the building. In the deadliest week yet of the COVID-19 pandemic, India recorded more than 26 lakh new cases and nearly 23,800 deaths in the past 7 days. Although daily infection numbers registered a slight drop after hitting a peak of over 4 lakh on Friday. At least 3.4 million people are currently being treated, but medical experts say actual numbers could be 5 to 10 times higher. At least 11 states and regions have ordered curbs on movement to stem infection, but Prime Minister Narendra Modi's government is reluctant to announce a national lockdown, concerned about the economic impact. India is in the grip of its biggest crisis since Modi took office in 2014. He has been criticized for not moving sooner to limit the spread and for letting millions of largely unmasked people attend religious festivals and crowded political rallies in 5 states during March and April. For iAfrica News, I am Fatoumata Kasim.
Now, Zimbabwean farmers' decry of lack of financial support will soon become a history as the government introduced a land bank program that could enable farmers access funding to boost their agricultural activities. The new initiative is part of the government's plans to transform the country's farming industry to enhance production, according to authorities. An initial amount of over $8 million to approve to support the program. Here is more of that.
Zimbabwe has restructured Agribank, a commercial bank, into a diversified agricultural finance institution to provide crucial yet sparse finance to farmers so they can enhance their productive capacity. Thousands of farmers resettled during the country's land reform program have decried the lack of adequate finance to scale up their operations, resulting in low productivity and underutilization of farms.
This is an integral part of our agriculture and food systems transformation strategy. Inclusive, sustainable agricultural financing and development are among the key success factors for a transformative agricultural sector. The agriculture and food systems transformation strategy will transform agriculture from a US $5.3 billion industry to a US $8.2 billion industry by 2025, with exports exceeding $4.5 billion by that year.
The Land Bank incorporates a commercial bank, leasing arm, and an agricultural insurance division to mitigate the risk factors that have plagued farming in recent years due to erratic weather. Unlike existing commercial institutions, the Finance Corporation will not necessarily insist on collateral security, but advance some loans on the strength of business projects. The provision of appropriate finance is crucial to helping small-scale and communal farmers make the transition from seasonal and subsistence farming to more commercially viable agriculture. 700 million Zimbabwe dollars, about $8.3 million US, has been allocated as initial capital.
A strong balance sheet for the Land Bank, Your Excellency, is critical in order to enable it to undertake its mission of underpinning agricultural recovery and growth. And to this end, government is exploring various strategies to strengthen the Land Bank's balance sheet, including the transfer of unencumbered state land to the Land Bank.
Zimbabwe's agriculture sector is set to rebound on the back of a good rainy season that's seen a surge in production across major crops, including maize, whose harvest rose from 907 million metric tons in 2020 to a projected 2.7 million this year, and tobacco, whose deliveries are forecast to rise to 200 million kilograms from 135 million last year.
Concerned Muslims who wear the hijab have rejected the criminals of people who disguise as pious people under the cover of the hijab. In this vox pop at the Serekunda market, several young ladies emphasize the wearing of veil as a religious requirement and that whoever is misinterpreting that image will surely be exposed. Binta Fati has the rest of that.
Hijab wearing is one of the most common identity of female Muslims in the Gambia, and it cuts across the population, especially during the month of Ramadan. Despite its religious significance, the dress code is being used in certain instances by criminals in disguise of good Muslims to commit crimes such as theft. Walking along the streets of the Serekunda market, I asked the view of some young women about the recent wave of theft allegations on supposedly disguised members of the society under the cover of the hijab.
Allah said in the Quran, there will be people who would dress like Muslims when they are not Muslims. They just do evil just to defame Islam. This is bad as it tarnishes the image of those putting on the hijab. Moreover, it is going to discourage others who might want to put on the hijab because they will think that people will call them thieves at the market. So I will advise them to stop it because our image will be tarnished at the end. The issue makes me sad because people now point at us when we put on the nikah. They would say, these are the people who steal. The person puts on the nikah just to use us and blame us. It really makes us sad. Maybe the person is not even a Muslim. They just use the hijab just to go and steal. That's why they have been exposed. You know, sometimes some of them are not hijab. They just put it on to do evil things. Look at it. It's not nice because there are people doing hijab for the sake of Allah. For others, they are just doing it just for bad things because the veil is big. Even if you steal something, people will not know it.
Their reaction followed cases in which the full body covering is misrepresented by thieves, some of who were allegedly exposed by CCTV cameras in a shop at the Serekunda market. News of these cases trending on the social media has brought shame to those who wear the hijab only on religious grounds. One of them had this way to react.
I'm short of words because someone who covered her body for the sake of Allah to turn and steal, that is not good. Nobody should do that. They just tarnish in the image of those who put on the veil and the religion.
In the Gambia, women who cover themselves in hijab are respected as they are considered pious and honest people. They are models in society who anyone can entrust responsibility without any need for fear of disappointment. However, with the increase in crimes in the market and perpetrators being women in hijab, The credibility of women who put on the hijab is being tainted, paving a reason for the pointing of the wrong fingers at them. For Africa TV News, I am Binta Fati.
Since the outbreak of the novel coronavirus last year, patients of other diseases such as tuberculosis struggle to access medical treatment in many African countries, including Nigeria. As featured in this report, a man diagnosed with TB felt abandoned after almost all medical treatment centers focused fully on COVID-19 related activities. However, the Nigerian government says it will prioritize tracing and treatment of patients diagnosed with tuberculosis. Details in this report.
For most of last year, 47-year-old Garba Ibrahim suffered from tuberculosis. He couldn't get treatment at hospitals because most hospitals were overwhelmed attending to COVID-19 patients. Eventually, he found a hospital run by the NGO, Faith Alive, who took him in.
I had checked about 3 hospitals for treatment, but they didn't give me attention. I was fortunate to identify this place, and they considered my situation. It was during the lockdown, all attention was about COVID-19, so we who had TB were not considered at all.
While Garba found help, others haven't been so lucky. The National Tuberculosis and Leprosy Control Program says about 60% of cases went unnoticed and untreated last year, with 18 Nigerians now dying every hour from the disease. New cases have also hit a record, 47 every hour, 7 of which are children.
Currently, there's a rise in our tuberculosis cases for 2 reasons. When you see patients who cough, automatically you assume they are COVID patients. If you see patients that sneeze, automatically you assume they are COVID patients. So there's stigma towards COVID, forgetting that the major killer disease, TB, is still with us.
Experts say health workers need to pay more attention to tuberculosis patients and adopt better ways of identifying the diseases which share similar symptoms.
And it's important that we look at this together so that people don't die and the menace don't keep increasing and increasing because we are looking away from what we have at hand.
The World Health Organization says Nigeria is far from achieving its 2025 national target of halving TB cases and slashing mortality by 75%. But local authorities say they are doing their best to hit it. The Nigerian government has promised to prioritize detection, diagnosis and treatment of tuberculosis across the country. The main focus will be teaching people, especially those in rural areas, about the need to seek medical care early. And with such measures in place, more people with symptoms of TB could get diagnosed and treated in time without having to go through the harrowing experiences of Garba.
That report on Nigeria will take us to a quick break, and we'll be right back with the rest of the news on the world today. Stay with us.
The pride we take in our brand, the work we put into constantly change the landscape and elevate real estate in the Gambia, it's compared to none. From inception, our goal was to add value to the beautiful Gambian landscape. That's why we are proud innovators of community estates. Kololi Sands is an exceptional piece of work, tailored for ultimate convenience and luxury, to bring you an element of finesse that is rare but unique in its own. This is also our pride and joy, and we welcome you to the exquisite beauty right here in Kololi and right here on the waterfront. Kololi Sands, feel the ocean breeze at your doorstep.
Welcome back, and still on the world today. May 3rd is celebrated worldwide as World Press Freedom Day. It is set aside to raise awareness of the importance of freedom of the press and remind governments of their duty to respect and uphold the right of freedom of expression. In commemorating the day on Monday, our reporter Kadjatu Sek engages journalists in the Gambia on how vital is access to information in executing their duties, and she now tells us more.
Considering the media as the fourth estate, World Press Freedom Day is observed to raise awareness of the importance of freedom of the press and remind government of their duty to respect and uphold the right to freedom of expression. The UN General Assembly proclaimed World Press Day in December 1993. Since then, May 3rd has been marked as a remembrance day for journalists who lost their lives in pursuit of a story. The theme of this year's World Press Freedom Day, Information as a Public Good, underlines the indisputable importance of verified and reliable information. It calls attention to the essential role of free and professional journalists in producing and disseminating information. In the Gambia, journalists are of the view that press freedom means absolute right in getting access to information without restrictions. The Vice President of the Gambia Press Union, Mohamed Esbas, said, access to information in the Gambia is still a challenge, adding that the draconian laws embedded in the Constitution are limiting access to information. According to him, access to an information bill that is still hanging in the Parliament will not only benefit journalists, but also other stakeholders.
It was tabled before the Parliament, but before then, there were a lot of consultations. People were consulted to be aware of the bill. It's not only for journalists, but also even private citizens. Even the National Assembly will benefit from that access to information bill, because it compelled public officials to come out and speak and tell people how they are executing public funds. What are some of the policies that they are doing towards the development of the country.
The Fatu Network journalist Mati Senghor opined that denying journalists access is denying the public the vital information they need.
When it comes to the government officials, you'll be having countless, deadlines. Come today, come tomorrow, And I believe denying the press interview means denying the public, information that they need to, get.
Yankuba Jallo, a journalist from Froya newspaper, is among the journalists expressing concern over the government not prioritizing press freedom reforms.
You will see that there has not been serious approach to reforms with respect to press and media freedom. And this is why, since we have not more than 8 months to elections, we want to see at least a few of the reform, if not all. But you cannot call yourself a transitional government, prioritizing reform, and then you don't reform even a single law with respect to media and press freedom. We only have intention. Intention can only be realized if you apply, if you take step. So the governments will take step to show us that their commitment is actually in them.
The 2021 World Press Freedom Index of Reporters Without Borders ranked Gambia 85 out of 180 countries surveyed in 2021. A 2-point improvement from 87th in 2020. From the 55 African countries assessed, the Gambia is ranked 9th in West Africa and 10th in Sub-Saharan Africa. But the previous regime's repressive media laws are still in effect, and Reporters Without Borders urge the authorities to carry out the necessary reforms quickly in order to establish an environment favorable to media freedom. Kadijatu Seka, iAfrica News.
Now, in a bid to improve its fight and surveillances against the COVID-19 pandemic, the Ugandan government has temporarily imposed a ban on all passenger flights from India. The Asian country is currently battling with the second wave of the pandemic, with more than 300,000 daily new coronavirus cases being reported in the past 12 days. The World Health Organization officials encourage the public to take the COVID-19 jab as authorities reintroduce these measures to contain the situation. More in this report.
Ugandan scientists say they've so far detected 5 variants from different countries, and one of them is a highly infectious super spreader variant discovered in India. Health workers are now moving to contain the disease.
all passenger flights between Uganda and India are suspended until further notice.
The Indian Association of Uganda is rallying its members to follow the stipulated health guidelines. Ugandan scientists say so far one person has tested positive with the variant that was discovered in India. He is currently undergoing care. They are now advising the public to be cautious and suspend all non-essential travel to countries with high infections. Apart from India, travelers from the US, the UK, Turkey, South Africa and Nigeria, among others, have also been advised to suspend non-essential travel to Uganda. The World Health Organization is now encouraging locals to embrace vaccination.
When you get vaccinated, you ensure that your health systems does not collapse, your economy can be opened, and you prevent mutation.
Uganda has so far registered over 40,000 cases and more than 300 deaths. Scientists are hopeful that the new restrictions could help contain the spread of the deadly disease.
That report on Uganda brings us to the end of the World Today newscast. Up next is Gambia 24 with Sohna Tunkara, and bye for now.